Good evening, ladies and gentlemen. Welcome to another edition of Teen Training Tuesday. I like to call it Applied Neolife. My name is Esa Zanambasi. I am very happy to be the one to own this platform, but today I'm particularly excited that I am not the one presenting. February has been a month to focus on the family and to focus particularly on fertility. So the first Tuesday we did an overview, and then last Tuesday we had a session on females, the factors that impact women. Today we are having males. And then next week, hopefully we'll hear some testimonies and we'll have a lively discussion as we wind up the month of love, February. So I think that like good farmers, we have to be ready to have good quality soil and good quality seed. And we have a lot to learn on that one. We have discussed it before, but we all start as seed, and it is indeed a miracle that we are seed that fell on good ground. Today, I have the utmost pleasure of introducing a teacher, a real teacher. He happens to also be a medical doctor, and he's going to take us through factors affecting fertility in men. So welcome, Dr. Kabugo. I'm going to stop my screen share and invite you to share your screen. If mine will.
Now that's me.
That is you, yes. Awesome.
I'm fine now. Am I on? Am I audible?
You are loud and clear.
All right. Thank you very much, Dr. Eseza. It's my pleasure hosting me today. And I really want to say good evening to everyone who is on this platform today. It's quite a very nice evening here in Uganda. And I'm still in office, just that's why I'm not having my light very clear. But I'm happy being with you today and going to discuss this pertinent issue about male fertility. My name is Baker Kabugo. I'm trained as a medical practitioner and I'm a consultant. So I'm a systemic physiologist. In all, I do what we call metamedical practice. Metamedical practice is the integration of a patient's medical, nutritional, and psychosocial need when you are managing a disease condition. So when it comes to fertility, this is one of the areas that I think we can share knowledge together and then really appreciate the gift of procreation or reproduction. So I'm really so grateful and I'm happy being with you. Now, you see my first slide clearly talks about male fertility, and then we say why we need to raise the flag, because we are having a lot of families that are lacking children. They are lacking children, and blame can go to either partner. It can either go to the female or it can go to the male. Most unfortunately, the blame goes to the feminine part of it, which I personally do not agree due to the few reasons that we will be discussing today. So I'm so grateful. And let's go ahead. Why do we need to raise a flag to male fertility? In order to make sure that we remove the burden of guilt on women who are normally told that you are infertile, you cannot give me a child. Some of the women are able to produce, but some of the challenges of lack of reproduction come due to male infertility. And we are having a rising trend of people or men who are unable to reproduce. So now the question comes, what is male infertility? If that's what you wanted to know, it's very clear. I tried to define it in that slide. Male infertility means that a man has a problem with his reproductive system and is not able to establish a pregnancy. And now that is with a fertile female partner. So the partner might be fertile, but when you, as the man, you cannot establish a pregnancy. So that's why we say male infertility is rising. Now we look at male factors. Now, male factors are contributing to a lot of infertility. And you look at 20% to 30% of couples these days are having a problem with their fertility. But this is a contribution of the men, of the male side. And the male side, some of them do not want to accept that, not until they go for tests to find out what their status is in line with their fertility. Now, as we dive into it, we need to look at the structure of the reproductive organ so that we can fully understand where the main challenges of infertility in men is. And that is the reproductive organ. Of interest, we can look at the penis. You can see the penis. We have the urethra. Then as we go ahead, you follow along with me. We are looking at the bulbourethral glands, and then we are having the ejaculatory ducts. Then we have the prostate gland. You can see it very well. We have the seminal vesicles. Those are the seminal glands. They are the ones responsible for producing semen. And then we look at that duct, which is called the vas deferens. That is the duct which transports the sperms from the epididymis, which is attached on the testes that are covered by the scrotum. I think if you're following me very well, you have seen where I came from. So now that is the system. When that system is okay, when that system is fine, we are not going to have a problem of infertility. But when that system is not fine, then we will have a problem of infertility. You look at that, we look at the sperms. The sperms have to travel. They have to travel through the fallopian tube so that they can fertilize the ovum. The upper left side, you look at the penis, you look at the testes, and then we are seeing an arrow which showing how the sperms are supposed to move from the test to travel through the vas deferens. Those are what we call the sperm ducts, the ducts that will be taking the sperms, and then they will have to move. Then we look at the female reproductive organ. You look at the sperms have to enter through the vagina during sexual intercourse. Then they pass through the cervix, fighting their way as they swim through the uterus, and then they move into the fallopian tubes, going to the direction of the follicles, whereby they will find an egg for fertilization, which has been pushed out of the ovary. You see the number of eggs moving out of the ovary, but we are looking at sperm, which is taking over the fertilization process. And on the lower side of that diagram, we are seeing a sperm which is now trying to penetrate the egg of the woman for fertilization. Now, factors that determine the fertility of a man, they are three factors. One, we look at the amount of sperms that are released at every ejaculation. We expect to have over 39 million sperm load per ejaculation. So you can see in Uganda, if we are 50 million people, we expect one ejaculation episode to have 39 sperm emissions. So now the amount of sperm, if you are having low sperm being released, and we look at low sperm as a quantity of being 35 million and below, then we know that you are having a low sperm count. Then the second factor is the quality of the sperm and the size of the sperms released. And actually, this is what we are going to have to discuss today: the quality of the sperm and the size of the sperm. This determines either when you're fertile or you are infertile. Then the third one is, how clear is the passageway of the sperm roots into the vagina? For example, if we are having the vas deferens and the sperm ducts, when they are blocked, of course, we are going to have infertility. When we have partial blockage, then we will not have a full ejaculation. So now those are the three major factors that really impact. So we really need to increase our fertility if we are to do what? If we are to have babies, or if we are to reproduce. And I will get back with this same slide as I am concluding, but these are the major factors that we must consider if we are going to increase on male fertility. Cleaning up our environment, we are going to see how it affects us. Eating for fertility, so we are supposed to have a healthy diet. Frequent sex, frequent sex. No frequency, we say practice makes perfect. If you practice sex frequently, then you have chances of reducing your infertility. Then you get moving. That means it's a struggle. Don't think that it is a one time, or a 1 month, or a 1 year. It can even take you some 2 years if moving on, but trying to make sure that you are fighting your infertility. So it is not a one-time step. So if you're having insufficiency in your eating habits, you fill with supplements, just as we will be seeing that. Now, why is male infertility on the increase? We look at the causes of male infertility. One, we can have obstructive lesions of the epididymis and the vas deferens. Now, if we are having lesions, these are inflammation or lumps that obstruct the movement of what? The movement of sperms from the testes through the epididymis and then through the vas deferens. We say the vas deferens, those are the tubes that transport the sperms. Then second, we are having an increase because we are having a lot of nutritional deficiencies. These nutritional deficiencies are going to affect our hormones. So the production of healthy sperm will be compromised. Other factors, we can have endocrine disorders. Those are the hormones. We have genetic disorders. Those are inherited disorders. We have psychological disorders, the disorders that come because of the stresses of life. Psychologically, you are not settled. You become infertile because of that. And then we also have sexually transmitted diseases, which are very, very rampant these days in both men and women, and they also cause the increase in infertility in men. Then we also have what we call the exposure of scrotum to high temperatures. Exposure of the scrotum to high temperatures. Those who know how the positioning of the male reproductive system is, we know the scrotum, that is the sac where the testes sit, and they have to be at a lesser degree, a lesser heat degree. You know, the body temperature is 37 degrees centigrade, but the scrotum is 34. So it is slightly cooler. And the tests must be in a slightly cool environment so that they can keep the sperms very healthy or refrigerated. The scrotum is a refrigerator of the sperms that lie in the tests. And then we also have the exposure to workplace hazards such as radiation and toxic substances. And I think that's where SSI normally come in and promote the detoxification of our environment using the Neolife products, which is very good. So you look at yourself. If you are having an infertility problem, look at how exposed are you at your workplace to hazards, to radiations, and to toxins. Well, now the amount of sperm released at every ejaculation is 39, as I told you, 39 what? 39 million. The quality of sperms, we are going to look at it, and how clear the passage, we are also going to look at it. As the sperm travels to enter into the uterus through the cervix, now you can see it has to use force. Now, the force that they use are going to weaken some sperms. Others get damaged, and others fail to reach their destination. What we are seeing is a female reproductive organ, and that is how it is positioned. That is how it is positioned. And as we saw in the next diagram, in the diagram on the left, that is how the sperms travel. And as they are passing through the cervix, it is a hassle. Some will weaken, some will die. Now, causes of infertility in men is what we want to look at, and we will be very specific. We are going to look at the semen itself, and we will look at the sperm. The common cause of infertility in men, which you need to take from this presentation, is poor quality semen. And semen, this is the fluid which is containing sperm that is ejaculated during sex. Now, the possible reasons for abnormal semen will include the lack of sperm. You may have a very low sperm count or no sperm at all in your semen. Semen can move without sperm. Then two, some of your sperms will not be able to move. If your sperm does not move properly, this will make it harder for the sperm to swim to the eggs. So now we really need to know that the movement of the sperm is proper. Then we also have what we call abnormal sperms. Sperm can sometimes be can have an abnormal shape, and this abnormal shape will make it harder for the sperm to move and fertilize an egg. Many causes of abnormal semen are normally not explained, but we know there is a link between increased temperatures of the scrotum and reduced semen quality. Now we can see that temperature of the scrotum and the semen quality. Though it is not very clear whether if we put on loose pants, we will eliminate the heat that will increase the temperature. Some people say, now, you know what you need to do? Put on loose pants which are not really fitting you, which are not tight, that it might increase fertility. That is not so certain, but we have to take it the way it is. Now, what we are seeing here, these are the abnormalities of sperms. You look at those two upper ones, we are having a strong sperm. It shows you that I'm really strong, I can move. And an abnormal sperm is showing you its weakness, that I cannot make it, and the destination is death. Now, a normal sperm is found on the left. You can see it, the normal form. It does not have an amorphous shape. It is not too big on the head. And when you look at the tail is also well defined. But abnormal sperms, you can see it can either be too big, it can either be too small, it can have divided heads, it can have divided tails, it can have a problem with its middle part. So all that is a problem as they float or they move to pass through the cervix, just as we saw it. So we look at the quality of our semen. We have looked at the quality of our sperms. Our sperms must have the normal size and must also be of quality. But now we are looking at the quality of the semen. Remember, sperms come from the testes, but semen does not come from the test. Semen comes from what we call the seminal glands. And what we have there is going to explain to us why we need the quality of semen. And this quality really depends on two organs, one, our prostate glands, and the seminal glands. The maroon that is the bladder, urinary bladder, and we have those two vesicles. Those are the ones that we call the seminal vesicles. Those are the ones in charge of releasing what we call the seminal fluid. When sperms travel through those ducts that you see are converging, it is those glands, the seminal vesicles, that will release the semen. And that semen is the one which will mix with the sperms. And then as it goes down, then the prostate. You see the prostate, it is an onion-like organ, which is having a urinary duct going through it. Now that is the prostate. That is the structure of how the semen will come and mix with the seminal, with seminal fluids, and then the prostate fluids. Now, this is what we call the unmatched importance of the prostate and the seminal glands. The prostate, it collects and delivers mineral nutrients needed to feed the over 39 million sperms in transit into the uterus up to the ovaries. Now, you see, it is the prostate which is collecting the minerals which are needed to make sure that they will nourish those 39 million sperms. And among these minerals, we have zinc, we have phosphorus, we have calcium, we have magnesium, and we also have what we call acid phosphate and others. But the seminal vesicles, they provide the protein-rich seminal fluids that move the sperms through the cervix, uterus, until they find the egg for fertilization. Now, you see, we are getting the proteins from the semen, which is secreted by the seminal vesicles, and we are getting nutrients, that is minerals, from the prostate gland. So the importance of these two determines the fertility of the semen. And now this is how it comes to mix. This comes to mix. The sperm fertilization is boosted by the prostate when essential minerals are poured into the semen during ejaculation. I think you can look at where my cursor is. Now, this is a seminal vesicle. When sperms will come, they will come and meet with the seminal vesicle, and this is where they will get the semens, and then they will be moved downwards, and then now you see that branch, when you are into a sexual activity, your prostate will enlarge after collecting all those minerals, and it will block the part which brings urine from the bladder, so that only semen and the sperms will travel. Remember, urine from the bladder is acidic. Or if we change the pH at around this area, we are finding a what? A problem. So if your prostate cannot enlarge during sexual intercourse or activity, we will have a mixture of semen and some urine, which will change the pH, and then will kill the semens, will kill the sperms. And this contributes to infertility, because before the sperms go into the uterus to look for the egg, they must have a proper pH. Facts to note, I wanted us to also get this. Seminal fluid is slightly alkaline. The pH of semen as it is being ejaculated is between 7.2 and 7.4. That means that that's an alkaline, that is a base situation. But prior to ejaculation, before you ejaculate, 1 to 2 drops of a clear colorless liquid is secreted by the bulbourethra glands, so that now for them, they can neutralize the acidity in the urethra. Remember, the urethra will have to remove urine, and it is the same channel through which semen will be traveling. So it needs to be neutralized. So it is the bulbourethra which does that activity of neutralizing, or of neutralizing what? Neutralizing the conditions in the urethra. And then there comes the milky secretion of the prostate, which is full of those minerals, and then finally the spermatozoa will also come through the semen alongside the sperm. But the vaginal pH is acidic. Why is it acidic? Because it has to kill all the germs that might come and interfere with the health of what? With the health of the sperms. So once that acidic environment is there, most of the germs are killed. And now we are coming with an alkaline semen, meeting the acidic part of the vagina. And the sperms must run very fast. They shouldn't delay in the acidic environment. Why? Because if they remain there more, that's why we are looking at the speed of your sperms. If they remain there more, then they will be killed by the acidic environment. Let me bring back that diagram again. You see that sperms should not delay in the vagina. They have to run through so that they can go through the cervix, so that they can get away from the acidic environment of the vagina. And it is only the strong sperm, just as you see that left one, which is boasting of its strength, and it has managed to pass through. Then we also have the problem of male infertility will come from the testicles. The testicles, they produce and they store sperm. If your testicles are damaged, it can seriously affect the quality of your semen. And this damage is normally caused by an infection of your testicles. That is, if you are having infections, these infections will cause the swelling of the testes. And this is normally caused by certain diseases like mumps, gonorrhea, chlamydia, and all other infections that will happen. Then we also have cancer of the testes. Cancer of the testes will also damage the testes. And remember, where cancer is, all tissue is taken away. Then we also have surgery. You might also have undergone surgery where part of your test has been removed or cut off during surgery, and then your tests are damaged. It causes infertility. We also have a problem with your testicles, which we are born with. We call it the congenital defect. You are born with that defect right from infancy. And then we have undescended testicles. You see, when you are still young, your testes are slightly inside, they are elevated inside, but when you reach puberty stage, they will have to descend into the sac. The sac, that is the skin that contains your testicles, it's called the scrotum. So they have to descend so that they can have a good temperature for the manufacturing and storage of the sperms. So if you are having undescended testicles, then there's a problem of infertility. And another one is accident. You might have an accident and you damage your testes. Now that is a big problem. So another cause of infertility is sterilization. Some people choose to have vasectomy if they do not want to have children, or if they do not want to make more children. Now this involves the cutting and sealing off of the tubes that carry the sperm. Now, this does not mean that you are not fertile. It's because the tube which takes the sperms has been blocked, and that causes infertility. We also have what we call ejaculation disorders, whereby some men have problems when they are ejaculating. Now, here we are having the physiological approaches and pathophysiologies that contribute to infertility. We have hypogonadism. Hypogonadism is an abnormally low level of testosterone, the male sex hormone. This male sex hormone, which is involved in making sperm. This is normally caused by a tumor. If you are having a tumor or you are using illegal drugs, when you talk about illegal drugs, we are looking at marijuana and everything. So that causes hypogonadism. Then we also hypogonadotropic and hypopituitarism. Now, those are terms that are really medical, but let me take them the way they are. But this is when your pituitary gland produces low levels of what we call luteinizing hormone. Luteinizing hormone is for men, and follicle stimulating hormone, FSH. Now, sperm development is normally arrested, or we do not develop our sperms if we are having low levels of those hormones. So this causes the loss of germ cells in the testicles, and it also, and in the seminiferous tubules, also in the Leydig cells that normally start to deteriorate. And when they deteriorate, then you get a problem of infertility. So we also have what we call panhypopituitarism. Panhypopituitarism is a condition which refers to the failure of your pituitary gland to produce hormones like the luteinizing hormone, we talked about it, the follicle stimulating hormone, the thyroid stimulating hormone, the TSH, and the growth hormone. So inadequate quantities of these hormones will affect sperm production, and this will lead to male infertility. Another cause is medicine. For example, if you are under chemotherapy treatment, you will have problems with production of sperms. And also using anabolic steroids. These are steroids that are normally used to build muscle, especially by athletes, in order to improve their performance. This act is very illegal. So long-term misuse of these steroids can reduce sperm count and the sperm mobility, the movement of the sperms. We also have a problem of herbal remedies. Some people use herbal extracts, but some herbal extracts that come from roots, especially the Chinese herbs, they can affect the production of our sperms, or they can reduce on the size of our testicles. So now you see there are a number of factors there that we need to consider. Sperm movement and sperm density is another thing that we must consider. When we talk about sperm density, we are talking about how heavy your sperm is. That is how heavy your semen is. Even if the male's body produces enough viable sperm, sometimes the factors and conditions that affect how or whether the sperm is moving can also contribute to infertility. Sperm may be moving too slow so that it dies before it reaches the eggs, or the sperm might die because the seminal fluids are so dense. They are so dense, they are so thick so that the sperm does not move properly. So there is that problem. We look at the density. Then we have another problem. We call it retrograde ejaculation. This normally occurs when your prostate does not close off the area which brings in urine during sexual excitement or sexual encounter. And now, instead of your semen or your sperms moving downstream to the penis, they start moving back to the bladder. That is what we call retrograde ejaculation, and it causes a lot of male infertility. Then we also have cystic fibrosis. Many men with cystic fibrosis, they lack, these are tubes, the tubes fail to move the sperms or to carry the sperm out of the testicles, making men or making a person infertile. But doesn't mean that you are sterile, no, because you produce the sperms, but because of that fibrosis, they do not move very well. Now the question is, what is the ultimate solution after understanding that we have a rising trend of male infertility, and we are looking at this problem as growing? It is still growing because of the pollutants and toxins. What are you supposed to do? If you are not so sure of your fertility, please go for a test. Go for a test. One, we will have a physical examination of your reproductive system. Then we will do a semen analysis, and then we do a hormonal analysis. You have seen that we are having three factors that contribute. One, the movement of the sperms or of the ejaculates. Second, the quality of your sperm. We do a semen analysis, and then we look at the hormones. Go and find out and know if you are in good shape in all this. This is what we need to do. If you find out that you are having an infertility problem as a male, please, these are the 4 things. I even talked about them. You need to consider them. 1, clean up your environment. 2, eat to fertility. Eat a healthy diet. Have frequent sex. In most cases, blockages are as a result of not having frequent sex. Remember, exercise makes perfect. You need to make your system perfect in moving those gentlemen from you onto their way into the uterus for fertilization. Get moving, which means don't lose hope. Make sure that this is a fight that you can fight. But if you're having a nutrient deficiency, please make sure that you fill the gap with the supplements. I think, Dr. Eseza, can you please share for me the cleaning products that we have as a solution in our family, in our Neolife family, so that we can show people how they can detoxify their environment to fight infertility that is growing. Can you please share?
Yes, please.
I want the cleaning products.
Stop sharing.
I stopped sharing. Well, I think I'm stopped now.
Okay, thank you, so that I can share. I've got a very abridged version of the slides. Let's start from, okay, let's just move down, sorry. You just want the cleaning. I will show some others later on.
Yeah, you can.
Okay. I'd prepared some as you had.
Okay, let me first go to the core nutrition, isn't it? Oh, okay, now I have the cleaning products. Thank you very much. And just as you stated, this charity begins at home, even fertility begins in the house. Now, you see, all the products that we use, the cleaning products that many people use in their homes, they are toxin-full or chemical-full products. For a person to fight infertility, you must use, please note this, you must use chemical-free products as your cleaning products. And in Neolife, we have LDC, which can be used especially to clean up. It is a light duty cleaner. We can clean a number of things in our homes, from washing our hands, from cleaning what we are going to eat as raw salads and whatever we are going to use, as we are preparing our meals. For example, washing our dishes, we use LDC. LDC is economical, powerful, and it is also earth friendly, and also it is non-toxic. And as you are washing your clothes, because remember, it is these clothes sometimes which you put on, and when you sweat, they will react. The chemicals that you use as you are washing your clothes will react with your body, and then we will have what we call toxicity. We will have a toxic uptake. So what we normally use, we use G1 laundry. G1 laundry is a very good laundry powder. It is earth friendly. It does not have harsh chemicals. And even if you sweat with your clothes on, you are not going to get those toxic chemicals. We also have care in our home care range of products. It is a disinfectant. You remember we saw that if we are having infection will also impact us on us in fertility or in our levels of fertility as male. I just wanted to get through them. Please make sure that you detoxify your environment. Don't use toxic products. Look for products which are non-toxic. And then let's go to our nutrition part of it. Remember, it's all about what you eat that will create fertility, that will make you more fertile. We said what we have. Let me, can I have the Pro Vitality? Pro Vitality, I won't go into depth with all of this, but you see, Pro Vitality is a core nutrition. Our body needs the following nutrients for it to nourish or for it to be nourished. One, we need carbohydrates, because carbohydrates are the energy-giving food, but the carbohydrates we have to take must be in form of whole grain food. That is how we cover the carbohydrate or the carb gap that our body needs. When we say whole grain, we mean you eat the whole grain, that is eating the seed coat and the cotyledon, because the seed coat has oils that are referred to as lipids, and these lipids, they are the ones that the body uses to make the cell membrane, because the cell membrane is a bilipid layer. So we can only get sufficient lipids when we eat seed coat oils. So eating whole grain means you are going to eat the grain with a seed coat, so that you can get the carbohydrates, which will be converted into glucose for energy giving, and the lipids, which will help to make sure that our cells are smooth and permeable. The nutrients can enter and the waste products can get out. The problem that we normally have in our diet, we have stripped off the seed coat, so we don't have those oils, which are lipids, which can help us to nourish the cell membrane, so that we can have all the nutrients get in and the waste products get out. And as a result, now that causes infertility, because remember, sperms are cells, tests are made of cells, everything, the male reproductive system is made of different cells, which have to be performing at higher peaks to make sure that they can work. Then we also need omega-3. We need omega-3. Omega-3 is fish oil. I normally term it into cold-blooded oil. Because we are warm-blooded, we need cold-blooded oils. Cold-blooded oils, these are oils, all fats, that do not cool or that do not form that do not condense when they are exposed into room or cold temperatures. Like fish will stay in water, and its fats will remain as oils. So we are warm-blooded animals. All the fat that we make is called low density. It means it will cool very quickly as temperatures reduce. And that is the body's response to fight off coldness, so that the blood will not clot. But if we do not have balanced oils, then we are going to have a hormone imbalance. Many of the hormones that work on the reproductive system, they are made from cholesterol. And cholesterol, we need good cholesterol and bad cholesterol. So when we have omega-3 that is provided by Neolife, we are having a real good supplement that will help us in balancing our nutrition. Remember, omega-3 has fatty acids, and those fatty acids are so essential in management of hormonal responses. Can we go ahead because of time? That is the salmon oil that we have. It is a high quality oil that we can use to get high density lipoproteins or higher density cholesterol, which can counter react the low density cholesterol. Can we go to the next one?
I think that is what
what you had. All right. So
I had a shake, but it was in the first slide. Would you like me to show?
We also need Neolife shake. Neolife Shake. Neolife Shake is a protein powder. Remember that we are warm-blooded animals, and what we do is we will have what we call animal protein and plant protein. So in order for our hormones to be working very well, we need plant protein. We need plant protein, and it is these plant proteins which is so essential. Remember, proteins are converted into amino acids, and these amino acids are the building blocks of our cells. We have essential amino acids, which are normally 9, and the rest are non-essential because the body is able to make it. And in order for us to get these essential amino acids, we need plant protein. Remember, man lives for plant, and the plant lives for man. When you die, the plant will feed on you as fertilizer, and it will be very healthy. And that's why we really need to feed on plant to get good proteins. That's why we call it plant proteins. So we need plant proteins. There's a lot we can learn, Dr. Esses and everyone who is on call, but we cannot finish everything. Please accept me. Let me appreciate you for hosting me today. My time, I think, is finished, and I'm really so grateful to whoever is on call. I'm so thankful for this opportunity. I hope we are all going to fight to make sure that we remain fertile for as long as we should. And that is how we are going to leave the ancestry or a legacy on the earth that we existed. Thank you very much, and thank you, everyone.
Thank you so much. Ladies and gentlemen, this has been so comprehensive. I have learned a lot. A lot of it I may have seen in bygone years and had forgotten. My goodness, this just brought back a lot, and I also learned a lot of new facts. Thank you. So next week, we would love to finish the month of love, the month of February, and obviously our focus being healthy families, with a discussion. So we'll see how it will go. If you have any testimonies particularly, or if you have clients that have had great success with our products, please encourage them to log in and tell us about it. Thank you very much, Dr. Kabugo, and to everybody else. Good night, and we'll see you soon.